Hi, welcome to my channel. I'm Soo. I'm a physical therapist from South Korea. Today, I want to talk about trauma, physical pain. If you have chronic pain, sometimes you are totally okay. Sometimes you have severe pain. Of course, guys has always pain, but you can do ordinary things like washing the dish or cleaning house. But sometimes the severe pain comes to you. Those people who have this kind of pain get the test to find your problem, but the test totally okay, there's no problem. And if you do some exercise like Pilates or yoga, the exercise gonna be trigger, so you got the severe pain. Okay, so how can you handle this? The problem is not your physical, like joint or muscle. I'll give you some example. If you have lumbar surgery and your lower back become totally normal, but at any point your brain feel you're still under the pain. So your lower back muscles get very strong contraction. That contraction and dysfunction make another pain. That pain will brain. The pain information is sent to the brain. That is vicious circle. Okay, how can I handle this? I want to focus on the muscle function, because if you have a trauma, physical pain, the whole muscle don't get the contraction. Just piece of muscle get very strong contraction. That give you the pain and muscle dysfunction. So I recommend you to try do my technique, piece of muscle contraction. It's funny, we try to get piece of muscle contraction, but this piece of muscle get already muscle contraction. How can you do that? There are some steps. First step, find your piece of muscle. Second step, get this muscle contraction, maybe 70% of maximum contraction. And then in third, you can do piece of muscle contraction. Okay, today's muscle is levator scapular. So first, find your muscle rod. Second, get your muscle contraction, 70% contraction, like this. Okay, and do piece of muscle contraction. Why should we do this? If we do my technique, your brain can feel very strong muscle contraction, 3D muscle image. The sense make your brain be right. Okay, my technique is not easy for ordinary person, but if you're therapist, physical therapist, or chiropractor, these guys can learn and do it easily. So I hope my technique give you a lot of help. Thanks for watching my video. Bye bye.